And with that, I'm going to hand the baton over to another one of our incredible committee members, Dr. Linda Greenwald. You know Linda from her lecture also on children and the ethics of working with children that happened earlier in the year. She also has done many things. As many of you have had her as a mentor, know her as a person who's worked seriously in public health for her whole career. And she also has a quality that you may not be aware of. She's amazing regarding time and time management. So we actually anointed her with the honor of running the webinar today. Linda,
thank you.
All yours.
Deborah, thank you so much for the introduction. And we're very excited tonight to hear the presentations of our students. Again, I'd like to thank the committee who've worked so hard this year to get this program off and running as a pilot program, and also to thank all of our students right now for participating in the program, for helping us, and for being involved in our program. And we look forward to continue to hear your success as you go along. So we're going to start off, first of all, the way we're going to run it. I sent you all an email. We're going to give you 4 minutes. I'm going to set my timer, so I'm going to check really carefully. We're going to give you 4 minutes to do your presentation. And so the chat tonight is very important that you put your questions in the chat. There'll be 1 minute for questions and then for uploading of your PowerPoint. So without any further ado, I'm going to call on Ari Walsanusari to do the first presentation. Thank you.
Okay. Hello, everyone. Thank you, Linda. So let me share my screen. Can everybody see my screen?
Yep. Thank you.
Do this share screen.
That's great. You just need to press yeah, that's it.
Okay, can I start it, Linda?
Yeah, please do. Please do.
Okay, thank you, Linda. Hello, everyone. My name is Ari. I'm from Indonesia. Today, I would like to present my research entitled The Effect of Educational Video Method Using Hand Puppets on the Knowledge Level of Dental and Oral Health in the Children of Rumah Pelangi, Indonesia. So as we know, dental and oral diseases are the most common non-communicable diseases in the world. In my country, Indonesia, 67% of children aged 6 to 14 years old have suffered from these diseases. Moreover, Indonesian Ministry of Health also stated that Indonesian youngsters who do not go to school and who drop out from school have the highest prevalence of suffering dental diseases based on educational level. It shows that education has a detrimental effect of children's oral health. So in order to educate these children, we have to use a method that is attractive and fun for them. Recently, another research has shown there is a significant improvement of children oral health after educating using hand puppets. Therefore, the major objective of this study was to investigate the effect of educational video using hand puppets on the knowledge level of dental and oral health in the children of Rumah Pelangi, Indonesia. This research is a quasi-experimental with one group pre-test and post-test design. So we examined children's dental and oral health knowledge level using questionnaire. On March 27, we took the pre-test, and after that, children were watching an educational video using puppets that was originally created for this research. And on the time, we also celebrate World Oral Health Day. So we also did other activities like playing games, dancing, and giving them free toothbrush and toothpaste. Afterwards, 14 days later, children were asked to come and to take the post-test with the same questionnaire. Okay, let's move on to the result. There are 37 children in Rumah Pelangi, aged 6 to 14 years old, who agreed to participate in this research. Rumah Pelangi is a community for dropout children in Bali, Indonesia. And result also shows that most of children who participated are in age 6 to 8 years old and female. And as you can see in the diagram here, we categorize the score into two categories: good for those who got 5 or more than 5 score, and not good for those who got less than 5 score. And as you can see, there is an improvement of good category in the post-test. So in this graph, we can see there are improvement of children's score with the 16% average increase. Data were analyzed using man-Whitney test with the p-value is 0.011, which is less than 0.05. It means there is a significant difference between children's knowledge level before and after receiving the education. Based on that analysis, we can conclude that there is an increased level of dental and oral health knowledge in the children of Rumah Pelangi after watching the educational video using handpads. And this method can be an alternative for increasing dropout children's dental and oral health knowledge level. And the last, future researchers should focus on scrutinizing children's attitude and behavior after receiving the education. Okay, I think that's all my presentation. Thank you for listening.
Well done. Well done. That's 4 minutes. You got it. Excellent. Thank you so much.
Thank you.
So questions now. Does anybody have any questions who they would like to ask for Ari's presentation? Any questions in the chat here? Joseph Greenberg.
Hi, who designed the puppets and the show? Did you do it by yourself?
Yes, I have teams, so we make the storyboard together and we record the story.
Fantastic.
Thank you so much.
Excellent. Anyone else? Any other questions? Did you have a question for Ari? No. Okay, you've got a hand up. Okay, great. All right, excellent. Thank you so much. I'd like to actually see a picture, Ari, of the puppets. I don't think you showed the picture, but you could maybe put it up in the chat afterwards. Thank you so much.
Okay.
Really, really impressive. We're going to move on now to Badiata, who's going to give his presentation.
Hi, let me share my screen. Thank you, Linda.
Sure.
Is it now visible?
Yeah, all visible. Thank you.
Okay, so let me start. Hi, I'm Rena, and I'm here to fight for inclusive oral health. In Indonesia, there is a particularly high prevalence of caries. In 5 to 9-year-old Indonesian children, the caries prevalence rate is 92.6%. Moreover, the proportion of oral health problems experienced by the people is 57.6%. However, ironically, only 10% of them have access to dental professionals. In this case, children with special needs tend to have untreated dental problems. They are often vulnerable due to their dependency on their parents. Parents' roles are extremely important to children with special needs, and it is important to know parents' level of knowledge, attitude, and behavior regarding caries risk for their children in order to mitigate and prevent caries in children with special needs. However, in Indonesia, especially in Gianyar, Bali, there are very limited data assessing caries experience in special needs children and their parents' influence in it. Therefore, the research objectives are shown as in this presentation. This research was conducted at a special needs school using a descriptive, quantitative with cross-sectional approach. 30 parents of special needs children at a special needs school called SDLB Negeri 1 Gianyar were interviewed with a questionnaire. The questionnaire comprised 4 sections consisting of demographic characteristic, 16 knowledge, 15 attitude, and 15 behavior question. The results shown as in this chart. Children's special needs in the research are divided into 3 groups, which are children with intellectual and mental disabilities, physical and hearing disabilities. Only 20% of the respondents have family income above the district minimum wage, whereas the rest have equal to even below income to it. One of the highlights shown in the crosstab between family income and parents' attitude and behavior is that even if there are 17 parents falls under the positive attitudes, 18 out of 30 parents falls on the moderate behavior instead. A previous study done in India found that mothers of special needs children had poor levels of knowledge and attitude regarding their children's oral health. Contrary to that, previous studies done in Qatar and Saudi Arabia showed that parents with special needs children had good levels of knowledge, positive attitudes, and favorable level of behavior regarding their children's oral health. The results in this research study lean to similarity with the previous study done in Qatar and Saudi Arabia. The majority of parents had moderate to good knowledge, attitude, and behavior. There was, however, inconsistency between the answers given by the parents during the interview. Probing questions revealed that some families experienced problems in accessibility and affordability of dental care. For example, parents had the knowledge and attitude that they need to do dental checkups. However, there are no dentists around their neighborhood or they don't even have money to do dental checkups. Referring to the reciprocity theory, behavior is determined by predisposing, reinforcing, and also enabling factor. Knowledge and attitude are included in the predisposing factors, and so that based on the theory, testimony from the parents, we can assume that there are possible interventions that can be done in enabling factors instead. In conclusion, to answer the research objective, the research found that half the parents with special needs children had moderate level of knowledge, 40% had good, 10% had a poor level of knowledge but carries risk. On the other hand, 57% has positive and 43% had moderate levels of attitude. And lastly, 37% had favorable, while 60% had moderate behavior regarding carriers risk. We suggest that further research would be needed to provide more evidence to help policymakers know which determinant factor should be intervened, so parents who are in low, negative, poor, and even moderate classes can develop and improve their oral health knowledge, attitudes, and behavior to be better. I would like to also give a shout out to my amazing team, the teachers of the special needs school, parents, and my lovely brothers and sisters with special needs at SDLB Negeri 1 Gianyar. And here's to more inclusive oral health. Thank you.
Thank you. Wow, excellent timing. Thank you so much. Excellent. I'm sure there will be questions. Does anybody have a question? It's impressive work you've done. Really, really good. Thank you.
Thank you, Linda.
Anybody else? Okay. All right. Thank you so much. We're going to then move on, if there are no further questions, to Joanne Egby. She's going to do her presentation.
Okay, thank you, Linda. So I'll be sharing my screen now. Okay, so I'm Joanne Egbe. I'll be presenting the Tooth Fairy project. So as a form of introduction, the Tooth Fairy project seeks to educate primary school children who are living in a slum environment in Ibadan, Nigeria, on appropriate oral hygiene practices to prevent dental diseases. Globally, it is estimated that 530 million children suffer from caries of the primary teeth. And although Nigeria has a low prevalence of dental caries of about 30%, but compared to the Western countries like the United Kingdom, but about 90% of these carious lesions in the primary dentition go untreated. So the objective of this outreach is to promote appropriate oral health habits, which is brushing twice daily, dietary changes in school children at an early age, to encourage the right oral health attitudes among school children and teachers in Ibadan, Nigeria, and to explore an opportunity for sustainability of oral health outreach projects in Ibadan, Nigeria. So the project site is a public primary school in a slum community in Ibadan, Nigeria. And the slum community identified as the Bere community in Ibadan, Nigeria. We'll be using grade 5 pupils And the primary 5 will consist of 5 class arms with 35 children per class, and that will give us a total of 180 children. And being that this is more or less like a pilot project, so we would still include other children in other classes, but for now, we want to see how effective this would be with 1 class arm. So we'll have a pre-intervention survey to assess the baseline oral hygiene practices and awareness of the school children. And after which we'll have the implementation stage, where we would educate the school children on appropriate toothbrushing techniques, on twice daily brushing, on oral hygiene practices. And then these toothbrushings will be done in the schools, and we also educate the teachers. And then we'll have a post-intervention survey 1 month after the implementation stage, basically to measure impact, to know how impactful this project was. So I just put a picture of the community where this project will be taking place in Ibadan, Nigeria, which is laid down here. So our expected outcomes, we expect behavioral change and right attitude towards oral health to primary school children, to over 180 primary school children in Ibadan, Nigeria. We also expect to have provided access to toothbrushing kits to primary school children living in a slum community in Ibadan, Nigeria. We also expect to have increased oral health education and awareness on preventable dental diseases to school children, teachers, and mothers. And we also expect to have educated primary school children on proper toothbrushing techniques. So at the end of the project, a report on the outcome of the project to be delivered by the principal investigator to the head teacher. So we're in the first stage of the project. We've gotten the toothbrushing kits for the children. We're also in the process of obtaining ethical approval. So the second stage, which is the implementation stage, will be done in June, and then the post-intervention survey will be done in July. So in conclusion, it is easy to effect change in habits at an early age, and these habits, when developed, are difficult to break. Hence, the need for effective school-based dental outreach projects to educate school children on the importance of proper oral hygiene practices and how this could greatly improve the oral health. So I'll actually have to use this time to thank the Humble Smile Foundation. We've received delivery of 200 toothbrushing kits that will be used for the implementation stage in June. So that's meant to start in June, and then afterwards, we'll have the post-intervention stage to measure impact of the project. Thank you very much. That would be it.
Thank you, Joanne. That's really excellent. Now, any questions from anybody? Joe.
Hi, is this going to be repeated in the next school year, or is the project over?
No, it's not over. It's going to be repeated. This is like a pilot project. So we want to see how effective this is going to be, and then we extend the tentacles to other classes in public school.
And Humble Smiles is going to continue to supply the oral hygiene kits?
Well, yes, we intend to send more sponsorship proposals to them, and they're willing to do that.
God bless you, Darren. Thank you.
Thank you.
Right.
Joanne,
Thank you so much.
I don't know if you can hear me well. Sorry, my internet is a little bit cut off. I think
Yes.
what also needs to be focused on is to really find the root cause, like in terms of nutrition, why is there so much tooth decay? And besides, of course, the proper oral hygiene measures, just to keep in mind that.
Yes, thank you.
Excellent. Thank you. Okay, so we're going to hand over now. Thank you so much, Joanne, for your presentation. We're going to hand over to, I think it's Ms. Hegenauer.
Hello. So I'm going to share my screen. Wait a minute. Can you see my presentation?
Yep.
Okay. Okay, perfect. So as you can see, the title of my project is Integration of Sustainability into Oral Health Care. And I'm going to click to the next slide. I want to show you my motivation, why I want to implement sustainability into oral health, and then the outline of the project. So my motivation is, first of all, climate change, then planetary health, which means the connection between the health of the planet and the health of humanity, which is very closely related. And then I think that we as dental dentists and other oral health professionals have a high responsibility to keep our patients' overall health. And then we have also the 17 Sustainable Development Goals from UN. And I have figured out that there are 3 main SDGs which fit together with oral health. And they are, on the one hand, good health and well-being, which is of course, and then climate action, which is very important to me personally, and then also the partnerships for the goals. And in order to make a good outline, I asked myself 3 questions. So the first question is, are oral health professionals even interested in implementing sustainability? And how should we implement it if they are interested? And how can we work together on these goals? So I took these questions for the outline and made different methods to fulfill them. And my first question, if oral health professionals are interested in implementing sustainability, I made a survey together with my association and asked dental students in Germany if they are interested in sustainability and what they think are the biggest problems and so on. And then I also founded a group which is called Youth for Sustainable Oral Health, together with 2 colleagues. And for Youth for Sustainable Oral Health, which is short for YSO, we made a manifesto and collected signatures on them. And then I asked myself, how should we implement this sustainability? And the outcome of the upper part showed us that education is needed and that we want to raise awareness globally through social media and lectures. And the last part, how can we work together on these goals? I think there are collaborations with associations and other projects needed. So here are the results and the conclusion. So on the manifesto, we had around about 300 signs from 50 different countries. And oral health professionals do care about sustainability, which is very obvious if you see that 300 people have signed on this manifesto. And also from the survey, you can see that German dental students are very interested in that topic. And the survey also shows that first measures in Germany have been taken, but more education is needed because many don't know where the real problems of sustainability lie within the job of an oral health professional. So my conclusion is that oral health professionals need to be educated about their impact on the environment in order to act wiser and educate others as well. And if we now look back on the SDGs I have picked out in the beginning, I think it's clear that oral health professions should share their knowledge about sustainability, and to do so, local collaborations such as the toothbrushing, education, and restorative treatment of caries program launching in Jacmel, Haiti, which is from Isidore, and global partners such as Alliance of Oral Health Across Borders are needed. So yeah, that's mainly what I did this year, and I'm very happy to be a part of here because it was always very inspiring and interesting.
Thank you. Thank you for your presentation. Any questions from the group? Deborah.
I'm interested in this organization that you founded as a result of your project, Youth for Sustainable Oral Health. I just have a more specific question to ask regarding that. Are these youth related to dental professionals, or are they a public group of youth who are not related?
No, we are all, or we have been, when we started, we have been all students of dentistry.
Okay.
And one of them is now done with studying and being a young dentist already. But we want to widen up our team for more oral health professionals. So we'd like to add, for example, medical students or other oral health professionals to our team as well. And I think it's very important that we are youth because that's something new and is also very important for education, because it's better to educate as early as possible and not in the end of your career as dentist. So
Right.
Yeah.
Wonderful. Thank you, Milena.
Joe.
Hi, Milena. Wonderful project. Does the
Thanks.
World Health Organization have any idea of what you're doing?
Not yet, but I hope they will one day.
You
You
should
have a
connect
way-
with them.
Yeah.
Yes, you have a way you could reach out to them?
No. But if
I could help you with
anyone
that,
can share a
perhaps.
contact, then I would be very happy.
Okay, Deborah says she's going to help you with that.
Thanks.
some
I will send a
connection.
link into the chat about my group and so on.
Brilliant. Please do. Tessa.
Thanks.
Milena, can you send the link like where the manifesto is available? to
Yes,
read the-
yes, I can.
Thank you.
Okay, thanks.
Brilliant. Thank you so much. Now, lots of good comments here. Thank you so much. Is Isidore here? Isidore, are you here?
I'm going to share my screen again because Isidore needs me to show his presentation.
Oh, okay.
So,
All right, great. He
yes.
asked me to do it, but you do it.
Yes.
It's fine.
I can do it. I can do it.
Great.
So wait, you can see my screen again?
Yep, we can. Yeah.
Okay. Nope. I'd like to zoom in. Sorry. I don't know how to make it bigger.
It's okay. Isidore, are you online? I can't see.
I don't see him online, so I'm just going to text him. Maybe we can push him to.
Jamie, could you check in your waiting room?
Got
He
it.
texted me he had fallen out. He had fallen out.
Yeah, he's not in there. So I just need to
Not
text
there.
him.
Oh.
I'm just gonna leave it like that because in presentation mode I cannot zoom in, so I hope that's okay.
The internet is he has
Isidore is
problems.
having connection issues, so perhaps we can revisit.
Yeah, well, let's revisit afterwards. Melanie, if you just keep
Yes.
it going, then we'll go from there. Isabayo is next on.
I'm sorry, Linda, whose name did you just say?
I said Isabayo, CB. Is it Clement?
Oh, Clemens. Yes,
Yeah.
he is on. Yes. Clemens,
Okay.
can you hear us?
Isidore's back and Clement is back. Clement.
Isidore
yeah.
is not back. Yeah, but
He
Clemens.
came on and then he's disappeared again.
Yes.
Yes, I'm back.
Okay, Clement, you want to do your upload your presentation?
Trying to connect my machine so that I can share the screen.
Do I have it for you?
Sorry?
I'm happy to show it for you. Let me just see. Do I have your presentation?
I'm trying to connect one of my machines. So
I have yours here, Clement. Would you like me to show it? Clement,
Yeah,
would you
I
like
think
me to
that's
show
a
it?
good idea. If you share it, Jamie, then
Is this
Clement
it,
can
Clement?
speak.
Clement, is this correct?
yeah, but I had
That
prepared
looks great.
another one too.
Oh, he
that I
has
can
the,
use.
okay, I believe he has the 4 slides too as well, Linda.
Okay. So do you want to, he
Yeah,
has it, do
I do have the.
you want to
Okay,
share your
awesome.
screen then?
Yeah,
Okay.
I had to prepare. I had to show the slides. That's would be the perfect
Okay, great.
to me.
So you want to share?
If you can't do it, you could also email it to me and I'm happy to do it for
Oh,
you.
that's a good idea.
Okay, let me drop it to the email.
Okay, so you want to do the next one, Linda, and then we'll come back to
Okay,
Clement?
let's go. All right. So
And Clement, email
Yes,
it to me.
yes,
Jean-Marie
yes.
Vianney, Jean-Marie Vianney H.
No,
Number
Linda,
7.
we moved him to the end.
Okay, fine. Maria, would you like to share your screen? Maria Gibran?
Could you give me 5 minutes?
Okay, sure. Kyrios. Okay, Kyrios.
Yes, I'm here.
Great. Hi there, Caleb.
Hi.
Hi, thank you for joining us. Would you like to share your screen?
Yes, please. Just give me a second.
Sure.
Okay, can you guys see my screen?
Yep, thank you.
All right, thank you so much. Good evening, everyone.
Good evening.
Okay, can I start?
Yes, please start.
All right, thank you. So my project's name is Oral Disease and Conditions in Marginalized Ethiopian Aid Beneficiaries. It was a clinical intervention project, which mainly focused on geriatric patients, but we also had other age groups. So ever-increasing evidence shows the relationship between old age, systemic disease, socioeconomic status, and oral health. TASFA Social and Developmental Association is an NGO with a mission of improving the lives of marginalized groups of Ethiopian residents. TASFA is an Amharic word which literally translates to hope. So the main objective of our project was to screen and treat patients suffering from oral disease and conditions at the TSDA head office, Addis Ababa, Ethiopia. This was a single day event. So the way we conducted this project was there are almost 4,000 individuals receiving aid from TSDA, and we made a call out to anyone that was interested to receive oral health treatment. So we had 138 willing patients. So we screened these patients and treated oral disease cases that they presented with, and patients with medical histories were so we collected the patient's histories using history sheets, and it was done in a standardized way. So the results from our clinical intervention and screening was out of the 138 screened patients, there were 12 cases of reversible pulpitis, 24 cases of irreversible pulpitis, 138 cases of root stump, 6 cases of chronic apical periodontitis or CAP, 186 cases of periodontitis, 6 cases of gingival polyp, and 186 cases of various types of systemic illness. So keep in mind that these patients had multiple oral health issues. When we screened a single patient, we found 3, maybe 4 root stumps. We also found irreversible pulpitis and so on. That's why the number of disease is so much higher than the number of screened patients. So after the clinical intervention project, we came to the conclusion that as observed, large number of patients exhibiting periodontitis and retained roots shows similarities with other marginalized and elderly groups in other parts of the world. I would like to thank Global Inspired Volunteers Ethiopia, Alliance for Oral Health Across Borders, Humble Smile Foundation, and the Ethiopian Dental Science Association for collaborating in this project and for letting me present my poster. Thank you so much.
Thank you so much, Clement. Appreciate that. Any questions from the group? Caleb, any comments you want to make? No. Okay, thank you so much for your presentation. Really appreciate that. Thank you. Maria, are you ready to do your presentation now?
Yes, just a second. I will share screen. Can you see my screen?
Yep.
Yeah. Okay. So hi everyone, my name is Maria. I'm from the Hebrew University, and today I'll be talking about the oral hygiene education across Bedouin community. So this whole project started when I was, the idea of the project started when I was in Thailand in 2017. I was also in oral hygiene project, promoting oral hygiene project in Thailand. And I always thought about how can I bring this kind of project to my country. And the closest community that I found, it was in the Negev, in the Bedouin community. And the Bedouin community, which comprised about 34% of the population, it's an underprivileged population, which is at the lower end of the socio-economic scale in Israel. And it's characterized by low income and high number of children. It has a high rate of severe early childhood caries, and the dental services there are very scarce. So we wanted to start. Okay,
yeah,
so
we can hear you.
we wanted to start.
I think there's just a scatter, but you can carry on.
Yeah. we were not sure about which type of project to run on this community, whether toothbrushing or start screening and treatments. So to answer that, we started first with the aims. And the main aim was to promote oral health in the Bedouin community, focusing on children at the early age. And we believe that the power of habit changing starts with the younger generation, and parents are affected by their kids' habits. So it's important to start with the younger generation. So what we've done is I first went to the Negev, and in collaboration with the NCF, it's a Negev coexisting forum that also work on it's also like working on promoting different aspects of equality for these people. So in collaboration with them, I went and visited a few villages there. And once we went there, we understand that we need to start a program first on based on supervised toothbrushing in the preschools before starting any examination, because we need to tackle the main root of the problem, which that the kids don't brush their teeth at all there. So what is toothbrushing, supervised toothbrushing? So let's look. So the whole idea is about to start workshop with the teachers. Our main project is going to be with the teachers. Each kid will have his own toothbrushing, and the brushes will be kept at school. Children will participate in daily supervised brushing session at school. This whole entire project should be really fun. And also diet intervention will be assessed. So we are going to be starting with 2 preschools and around 300 and 400 children. Parents will be also giving consent, and volunteer training in Hadassah Hospital was undertaken by the Dental Wellness Trust Foundation. Along with Linda, she came and we run this project with different volunteers. We're dentists also and medical students from Negev and from the north. It was really interesting, and I'm showing this video.
This is a toothbrushing song.
Yeah, so this toothbrushing song, we try to find a song that is mutual for everyone that kind of know, so to teach them for the kids, but we eventually will choose a song that also the kids will be involved. So based on that, we're gonna be running this project in the Negev, and we're also planning that once this project runs, we can also, each one of us in the team will find his own high school and run this project in there. Yeah, sorry. I would like to say that this project has been tackled with a lot of challenges, mainly with the challenges, whether it's politically or the safety issues, and the fact that this population is very far from home. It's also challenging for them, and also challenges for us to reach for them. So I would like to thank a lot Dr. Linda and Dr. Darren for the much of support they've been giving me, and for this project to run, and also of course for the Alliance for Oral Health for the entire leadership and tutoring. Thank you so much.
Thank you, Maria. Thank you so much. Are there any questions from the group? Darren.
Yeah, thank you. Thank you, Maria. My question is, you said that you decided on the toothbrushing intervention before you did an exam. So then my question is, so what problem or issue was the toothbrushing going to solve? I don't think you said it was going to solve the core problem, but I don't think you said what that was. And the other question is, were there any Bedouin kids involved in the singing that's supposed to make it fun for them, or were these non-Bedouin people deciding on the song for everybody? That's it.
Thank you so much. That's really interesting questions. What I was trying to say that the thing that we were thinking is that we want to run screening and treatments for these kids, because we think that the clinic are really far away. But once I visited these kids and I talked to them, and I understand that they have, although they know about toothbrushing and they even taught at school that they need to brush, they know none of them really brush their teeth. So I think even if we now treat the kids, this is not going to be really helpful for them later on, because I think we need to tackle the main idea that they're not keeping their health, oral health, like they're not using any brushes in general. So even if they're cleaning with a doctor, right, they're not gonna get later on like any effect because they're not maintaining their oral hygiene. So what we're gonna do is the supervised toothbrushing that we teach them every single day at school, that they will brush, and we make sure this project gonna be sustainable, since I'm still in school next year, and all the volunteering I have from the first year dental student until 6th year. So I make sure this project gonna run for further years. So later on, another volunteers project gonna be also on researching this community, and also running, bringing another volunteers to run screening and you know, like doing all the treatment, but that's for the long run. This is for the first question. For the second question, we either gonna bring song from us, but I think it's more interesting that we ask them if they have a specific song that they want to share and they can use. But that's something that's interactive. We can see what gets the kids more excited. And also, I like dancing, so I'm gonna be teaching them maybe some few dances that can make them active while brushing.
Wonderful, thank you. Tessa.
I have a question. Has a survey been done regarding nutrition or like fluoride or anything like this?
The last survey has been done for this community was in 2007. Right now, there is no survey, but we're planning on, once we're gonna meet with the schools in the next month, we're gonna be running, we're also gonna be talking about a diet with of course, with the principal, and make a survey about it. But if you have anything specific that you want me to include in my survey, I will be happy to know.
Thank you. Thank you. Darren, do you have any further questions?
I mean, I could go on backwards and forwards. Maria, you said you're going to do research. Once you've gone in there and instigated toothbrushing, you've lost the baseline for the research. The other comment is the 2007 study was done in East Jerusalem, and yours is in the Negev, but I'm not sure that you can really say there was a survey done on the Negev Bedouin.
Yeah, but I think again, the volunteering group that I now based, they're not only volunteering in the toothbrushing, they're also interested in running research. So two of my classmates, they're also gonna do this as their research project for their DMD. So we're going to be building the protocols along with them. So I think it's I know we want to rush and run the project, but I think if we really build a very good base for the project, it's going to be more strong for the long run. And that's how we can make a better research for the future.
Great. Thank you so much. Thank you, Maria. Thank you for your presentation. I'd like to now move on to Serban.
Hi, everyone.
I'm sorry, I just wanted to cut in for 1 second. Isidore is actually back on.
Do you want to go back to Isidore?
Yeah, so maybe we can just check it before he gets kicked off again.
Sorry, Krista, we'll come back to you, Krista. Let's go back to Isidore.
Okay, 1 second. It says he's joining right now, so let's just give it 1 moment. Okay, Isidore.
And Milena, you're going to share your screen.
Okay.
Kenton, are you back on? I just saw him and he might have gotten popped off again, so then we can, sorry about that. Okay, he's on, it shows he's on. Kenton, can you hear us?
I can't hear him. All right, let's give it a bit more time. Shall we move on to Krista?
Yeah, I can go.
Yeah, let's go on to Krista.
I'll share my screen.
Thank you. And share your screen and we'll come back to Isidore. Thank you. Okay.
Okay. Hi, everyone. Okay, so my project is called Oral Cancer Awareness of Undergraduate Students in Romania. So in Romania, we have one of the highest incidences of oral cancer among European countries. And although it affects mostly older patients, it's also prevalent in young people as well, also due to the human papillomavirus. So the aim of my project was to determine whether or not students in Romania are aware and young people are aware about oral cancer, and to examine this in order to be able to determine effective prevention strategies for the future. So I disseminated a survey to undergraduate students studying in Timișoara, Romania, and it was a questionnaire divided with 15 questions, divided in 3 parts. And I looked at risk factors, signs and symptoms, the knowledge about this, treatment and prevention attitudes as well. And the survey took approximately 5 minutes to complete. And in my results, I found that most participants, they identified smoking to be a major risk factor. However, alcohol and HPV were identified to a lesser degree. And this was also, identifying of these factors was mostly associated with students who were studying healthcare and medical undergraduate programs. And also I asked participants about their attitudes regarding to lifestyles and how it influences oral cancer risk. And most people did agree that developing oral cancer is not usually a matter of pure luck. However, some people were still unsure about this. And overall, this was a preliminary study, and it did highlight the need to conduct this study at a larger scale in order to understand how oral cancer awareness in young people in Romania really is. And the results will be useful in identifying future campaigns and targeting different prevention strategies for battling this oral cancer that is in Romania. Thank you so much.
Thank you. Thank you so much. Questions? Krista, I'm going to ask you a question. Do you know what percentage of students, of undergraduate students, smoke?
The smoking rate in Romania is pretty high. I don't know the exact number, but actually, and I'm very interested. We're still processing the results, but I'm very interested to see how this is associated with the results. However, I did have this question of whether or not they're smoking in the survey.
Yeah, whether or not they themselves are smoking.
Yeah. So I do have this as a question in the survey.
Yeah. So yeah, it's interesting. It will be interesting to find out more information on that. Thank you so much.
Thank
you. Any other questions on that? Thank you, Krista, for your presentation. We're going to call on.
I wanted to say something, Linda. Krista,
Sure.
I think that you did a great example of a scientific poster. Well done.
Well done. Yeah. Thank you. So now we're going to move on to Sobizik. I'm just seeing.
Oh, thank you.
Thank you.
Thank you, Dr. Linda.
Hi, Alexander. Thank you. Do you want to share your screen? Excellent. Thank you.
Can you see my presentation
Yes,
now?
we can. That's brilliant. Thank you.
Okay, perfect. Thank you. So the age demographics of my community has changed significantly in the last decade. In fact, the WHO predicts that the number of persons aged 80 or older is expected to triple by 2050 to reach 430 million. So in the spirit of thinking globally and acting locally, I have focused my project on elders living in institutionalized facilities. So my idea was to essentially improve the quality of life of care home residents. And this would be achieved through joint efforts of dental professionals and dental students in training primary caregivers on oral health issues most frequently experienced by the elder members of our society. But at the beginning, I've decided to investigate the current situation, which simultaneously has drawn the attention of care home managers to this problem. So although as a care home volunteer myself, I saw firsthand the negligence of oral healthcare. In that setting, I was surprised by the lack of local studies addressing the problem. Hence, I've reached out to care home managers with 19 questions on oral healthcare provision in their facilities. And with lack of policy, low funding, and prevalent self-ageism being the acceptance of poor oral health, the results were as initially anticipated. The survey disclosed that none of the participating care homes offers frequent dental checkups or even emergency interventions, and such must be organized by patients and their families individually. So as many elders in Poland experience poverty and physical or mental disability, this definitely seems difficult at the point of use. Additionally, I found out that the admission requirement for a new patient does not extend to dental history, which shows lack of attachment to oral care in general. And none of the participating establishments had a continuous cooperation with a dental or dental hygienist. And most surprisingly, not all pensioners with limited physical ability are offered assistance in oral hygiene. Only 1 in 2 patients can expect such help. So this study shows the need for urgent action in adapting adequate policy to improve the lives of elders. Care home management believes that the reason for this dire situation is low awareness of oral care among elders, their patients, transport problems, funding difficulties, and more urgent health matters. A total of 110 pensioners aged from 65 to 98 remains under the supervision of participating facilities. The last questions of my survey focused on the need and potential for my project. And the majority of care home managers described patients' awareness of oral health as rather low. And this, for instance, yields the possibility for engaging dental students in oral hygiene demonstration. Half of the questioned administrators indicated the need for oral care training among their workers. And so through the analysis, I was able to make the issue of poor oral healthcare more visible to the stakeholders involved and inform them about this project. I have since established a partnership with a local branch of Students' Dental Association, and most recently with the Department of Nutrition and Epidemiology at my university, which became an active supervisor of Smiles of Wisdom. And in the last weeks, I've also connected with an NGO which has experience in training care home workers, but sadly on other issues. I hope that this will allow me to learn about best practices and adopt them soon in this setting. And the training is anticipated to take place in July and August, because these are the months of reduced number of responsibilities for the caregivers, and they will be able to commit more of their time to this venture. Overall, my project stands on fundamental grounds of global oral health, which are sustainability and long-term effect, and working across disciplines to reduce the burden of oral disease. Thank you very much. Thank you to all the committee members and other participants, and especially Dr. Weiss for supporting me throughout the journey and navigating me through it. Thank you.
Thank you so much, Alexander. So where can I just ask you, where did you undertake this survey? Was this in Lodz?
Yes, correct. Yes, it was in Lodz, Poland. It was done digitally, but quite often I had to go in myself with the printed survey and ask people to fill it in because they had problems with the digital tools.
Yeah. And so what do you feel a long-term, I mean, there's a lot of opportunities here with all these challenges. There's quite a lot of opportunities. What would you see like a vision of the opportunities that you can take forward?
So definitely training the primary caregivers in long term will benefit patients who will come throughout the years as patients into those facilities. And although undertaking an action now with oral hygiene demonstrations for those who reside there currently can reduce the burden at this very minute, I believe that training the caregivers will give us the long-term effect.
Thank you so much. I think there's a lot of opportunity in making quite a big difference. I love the title, Smiles of Wisdom. I think Darren will be very interested in that for his other project. But yeah, that's really brilliant. I think you've got a lot of mileage. A lot more can be done, which is really important. You've highlighted these challenges. So thank you so much.
Thank you very much. Thank you.
Thank you. I'm going to ask Clement to come back to us now.
Yes, I can hear you.
Do you want to upload your presentation?
Yes, it comes so much. Can you see my screen? Can you see my screen?
Thank you. Yeah, we can see your screen. Thank you. Smile Rwanda.
So basically, my project is about reducing the carries into.
Can you speak a little bit louder? We can't hear so well.
My project, can you hear me?
Yeah, yeah, we can hear you. Yeah.
Yeah, so my project is about promoting, like eliminating the dental caries into school and the school children here in Rwanda, because there are a lot of dental caries into those children. So I'm going to the next one. By introduction, dental caries is a significant community oral health problems, mainly worldwide, because it occupies like 60 to 90% of the school children and the majority of the adults, and also globally reported as the issue of the world. Like here in Rwanda, the current problem here in Rwanda, that which made me focus on this one, is there is a high prevalence of dental caries into pre and school children, and also there's oral health education here in Rwanda is still low. It's not like really incorporated into the other primary health care here in Rwanda. Also, the dentistry here in Rwanda is still young, so the community did not get well to know about the treatments, about the prevention measures. And there's also myths in the community where some people believe that removing the toothpads may eliminate some diseases like diarrhea. So I want to eliminate these all like myths and everything to the community so that they can play a role into promotion of the oral health. And also, like my long-term project objectives of this project is to increase the awareness and the change of the community attitudes toward the oral health promotion, prevention of oral diseases, and access to different oral health care services. So I'm going to do my project through the trainings and education sessions, community outreaches, and oral health materials provision, radio talks. The photos here are the like attest to this project. We used the Dental Student Association here in Rwanda to went into primary schools where we went there and teach about the oral health hygiene, how to brush. And the picture below here is about the education to the community health workers as the primary health unity here in Rwanda, where they meet with different people in the community and the children, of course. So into the trainings also, I'm planning to provide trainings to the teachers and to the parents in the community. And also the outcomes that come with this project is to increase the awareness of the parents, how they can take care of their oral health of their children, and also to change the attitude of the parents towards their children. Like to limit sugary food content to them, and also to increase the knowledge so that they can really play a big role into the early childhood caries prevention. As conclusion, in Rwanda, more than 60% of the children, they really suffer dental caries and other health issues. So, which leads to the early extraction of the tooth and the other treatments which are not necessary to the children, which like let alone can affect their permanent dentition here in Rwanda. So that's what like mainly interests me to carry on this project. And thank you. If there's any question, you can ask, please.
Thank you very much. So any questions? Any questions from anybody? Right. Thank you so much for your presentation. I'd like to now call on Lincoln. I'm going to screen share my screen. Okay, so thank you very much. Clement, you can come out of the screen sharing now. Thank you.
Hello, everyone. Can you hear me?
Yes, I can. We can hear you. I'm just busy getting your screen share, your one now. And we just want to move that. Okay. Can you see the presentation now?
Yes, I
Great.
can. Thank you very much.
Thank you, Lincoln.
All
All
right.
right, you can give your presentation.
Okay. So my project, my name is Lincoln Abraham Tentena, and I'm presenting the project Bate Goes to the Dentist. Next slide, please.
There you go.
Okay, so a brief introduction about myself. Like I said, my name is Lincoln Abraham Tentena. I study at Makerere University, Kampala, and I am currently in my final year pursuing the Bachelor of Dental Surgery, and I come from Uganda. So a brief background about Uganda. Uganda is a country found in Eastern Africa. It currently has a population of around 45.74 million people, and it holds a record for having one of the youngest populations in the world. The capital city is Kampala. Next slide, please. Okay, so the project, like I said, it's called Bate Goes to the Dentist, and this was designed with a background of the prevalence of dental caries. Like someone said earlier, dental caries is one of the most prevalent non-communicable diseases in the world. And I found a study which showed that the prevalence of dental caries in East Africa is at 45.7%. And so, with the background of having a very young population and also a high prevalence of early childhood caries, I failed to find some data for this, but in my proposed solution was that we can have habit modification for the early age groups, whereby we're going to do education for them. The main objective for this project is to increase the oral health awareness among children aged around 4 to 13 years old. And the method that we're going to use is a storybook, which has easily comprehended lessons on oral health. And the storybook was developed in such a way that the characters and the story and the different happenings in the storybook are those that are relatable to the children that are found especially in Uganda, but this can also be applicable to anywhere else in the world. I wrote the story myself and I got it approved by a children's book editor, that's Stella Misango, and then I also cross-checked it with the pediatric dentist, Dr. Norman Musinguzi. So some of the outcomes that we hope to achieve once this book is published, currently we did the test reading with a group of children at an orphanage, and we got feedback from that, and we're modifying it accordingly. We did the book design, and also the diagrams are available. I can send them to the main group. So what we hope to get from this is that we hope to have a reduced prevalence of dental caries. Then we also hope to have increased awareness about the different things that we can use to improve our oral health. And this is something that we hope to promote among the children, whereby we encourage them to take care of their oral hygiene, to take care of what they eat, and also to encourage them to go for their dental checkups. And in addition, we also hope to have policy modification, which comes from the different research that we can conduct from using this book. This book can be used as a tool for conducting research, and an area that I'm particularly interested in is how beneficial, how effective it can be when we're giving this oral health education. Next slide, please. Dr. Linda, next slide, please. Okay, yeah, so here we have a cover page of the book that we are currently using, but this is liable to modification. The book is called Bategos the Dentist, and it's basically about a young boy, 6 years old, who where we narrate a story of him going to the dentist, and in this visit we look at him getting some oral health education from his parents, from the dentist that he finds, and also from the other people that are around. And I would like to acknowledge the massive assistance I got from Dr. Linda Greenwald in the development of the project, Dr. Norman Musinguzi, who was my supervisor back home, the Mola Group, from which we share different lessons, and also the Alliance for Oral Health Across Borders for giving me this opportunity and the knowledge that I've gained from this. Thank you very much. Dr. Linda, I think you are on mute.
Sorry, yes. Can you put, it's a very good project. Can you put a few more pages, just 2 more pages in the group chat to see, because it's beautifully illustrated.
I would love to see the book, actually. I would love to see the book.
Thank you. All right, so I'm going to
All right,
stop
great.
sharing.
Let me try.
Yeah, if you just put it on the main chat, that'll be great. Thank you.
All right, thank you.
If you can, that'll be excellent. Thank you. Again, it's a brilliant idea, and same as our other student, Ari Balsani, used puppets. Lincoln used a book a children's book to teach oral health messages, and has a lot of research opportunities going forward. Thank you so much. Any other questions? Okay, let's come out of that, escape that. Okay. Right, okay. If there are no further questions, then we will ask our next participant. Stop. I was just timing very carefully. Our next participant is Sophia Thomas.
Hi, Linda.
Hi,
everyone.
Hi.
Forgive me if I sound incoherent. It's 1:45 a.m. in India.
Wow. Thank you so much for staying up to present to us. We appreciate it. And it's 10 o'clock in Israel as well. It's very late. Thank you.
Okay. No worries. I'm just going to load up my presentation. One second. Am I audible?
There you go. We can see it nicely. Thank you.
Okay. Hi, everyone. I enjoyed all of your presentations. Very innovative. I would really like to follow up on some of your presentations, actually. The title of my project is Prevention of Tobacco Use and Cessation Program for Pregnant Women Accessing Antenatal Care in Public Health Facilities in Southern India. One second. Yeah. So basically the background that propelled me to do this project is that a lot of anti-tobacco initiatives focus on smoking as opposed to smokeless or any other forms of tobacco, and it's highly prevalent in Southeast Asian regions, and women actually consume them a lot more than men. Overall, I mean, there are some disparities, but there are some sections in India itself where women actually consume it much more because it's culturally appropriate, and for other reasons that I will come to on a later slide. When we talk about women, we have this entire life course from the time women, enter girlhood, adolescence, and what is most important is also, their reproductive age during the reproductive time. And so we found one of the studies reported that about 4.6% of women in India continue to use some form of tobacco, but mostly smokeless tobacco. And there are a host of adverse effects from anemia to low birth weight to stillbirth babies. And there is a really missed opportunity during antenatal care where we can actually educate women because you have a lot more women coming into these facilities, and it's actually a teachable moment where one can not only educate the women, but also continue to educate for childcare when they come in for immunizations as well. So I have two objectives for my project. One is to prevent tobacco use, which also includes secondhand smoking among pregnant women who access urban primary care facilities for their ANC care in Bangalore. And the second project is actually to build capacity among primary care providers, obstetricians, and essentially all the maternity providers who help women through their ANC period and through their postnatal care as well. Facilities where I'm planning to conduct the project is actually set in a very densely located urban poor neighborhood. And I'm conducting my project in two urban facilities, which are fundamentally different. One is an exclusive maternity home, whereas the other is a community health center. I will be, and I have to partner with the local government in order to get permissions, in order to have access and accessibility to these facilities to conduct my project. And this is a new project that I am conducting. I was conducting as a part of the oral health working group prior to my fellowship with the Alliance. And the target population are women in reproductive age group who access these facilities, and they are typically from very disadvantaged backgrounds, with coming from poor household, religious minorities, and they constitute a higher proportion of migrants as well. I aim to execute my project objectives through these methods. Number one being developing an oral health education program for the pregnant women themselves to dissuade them from using any form of tobacco and educating them about secondhand smoking. And second is to create a training module for the primary care providers to deliver antenatal tobacco screening, cessation, and also to help them refer women in case they need to be referred to de-addiction centers or dentists themselves for further treatment. So the outcome would be measured for the women through KAP surveys, which is knowledge, attitude, and practice surveys. So there will be a pre-test to measure their existing or baseline KAP levels. Post which we will have the intervention, which is the oral health education program, rolled out. And post the intervention, we will be measuring the effects of the program, the effectiveness of the program. And we will conduct in-depth interviews with the providers to understand how their journey has been in integrating antenatal screening, advice, referral activities, and the desired policy change. Hopefully not just with one project, but hopefully there can be like multiple projects that can be adapted to different contexts, is to include antenatal tobacco screening and cessation activities in the existing Indian antenatal care guidelines. I did bump into a few challenges, COVID, obviously, professionally and also personally being affected with the infection. And the permissions have just been a merry-go-round, going from one government office to the other. So last week, I've been referred to the highest level of health office that I have to now approach to get permissions. And I recently found out that one of the facilities is undergoing a renovation as part of a national program to renovate the infrastructure and such. So the next steps quickly then are to get the permission sorted out. My tools are ready. Everything is jet set go. But I have to pilot them before I actually conduct the project itself. And the next step after piloting asking is to register the project on Open Science Framework in order to have transparency so that I'm not duplicating projects, and so people can also see that such a project is available in public domain, and to map active cessation clinics in order to educate the clinicians better for referrals. And finally, as a part of the oral health working group with Dr. Lee, we recently submitted a workshop abstract on behalf of the maternal oral health group, and the title is Maternal Oral Health Models and Initiatives in Global and Public Health Perspectives. So one of the 5 abstract is this project. So hopefully we will hear something soon from the conference organizers by early June if we've been accepted. And if we are, then we would be presenting our work at the conference. Thank you. And I'm sorry if I overshot my time.
That's okay. All right. Thank you so much, Sophia. Any questions from the group? Good luck with the presentation to present it in Berlin. I hope they will accept it. I can see that there's going to be a lot of ongoing work, and hopefully COVID is a little bit more behind us now, although there may be some new waves and some new variants, but working in this challenging environment, it's been very tricky, and well done for what you've done. So now,
I think Deb has a question, Linda.
Yeah.
A quick question. Sophia, your project is somewhat complex, very sophisticated. I just want to acknowledge that. What do you expect about the permission problem, that barrier? How do you know from history? How long do you think it's going to take? And what things have to be surmounted for you to get the permission? You think it will just go through smoothly, or is that a problem situation?
It was a problem mainly because of COVID, because a lot of these officials were on COVID vaccination duties. Now they've come back to their offices, but I did expect that this local office that I went to recently, I would have it all clear, but they're a bit unsure of letting people in terms of, during COVID, during the pandemic. So they've asked me to just to be sure, just so that, my project is not halted in between, just to get the final set of permissions so that it can run smoothly. So they've actually, it's a good advice. So it will come through, and I'm hoping I can start early June.
Oh, wonderful. That's good news.
Yeah. That's great.
Thank you.
Thanks.
Thank you so much. Thank you. All right. Now we're going to ask Habamisha to present his project, and Jamie has loaded up the slides. Right, you're on. Can you hear us?
Yes, I believe Tambugisha did. I think he just loaded up his own slides. Did
He loaded it up himself. Yeah, because he's at 10 o'clock in Rwanda.
Okay, great. Yeah, all right. I was just looking for it. Okay, good.
Thank you. Okay. Habamisha, you want to get started? I can't hear you. You want to switch on you want to increase the sound so we can hear. We can't hear. If the sound is difficult, do you want to just show us your presentation? We can see your presentation beautifully. It was fine already. It's just the sound we can't hear. Okay. Right. So Kenson, we're going to call on you afterwards if everything is on.
Hello, do you hear me?
We can hear you perfectly, and we saw your presentation, but we can't see it now. If you just go back to the, that version, yeah. If you load it up, and then you can start. That's great. We can see it, and we can hear you now.
Yeah, thank you, everyone. I'm Muhammad Marie Vianney, intern dental surgeon in Rwanda. Also, I'm coordinator of the Giza Child Smile initiative. Yeah, my presentation, I'm going to present about Smile for All project assessment. As the introduction, the Smile for All project, we designed it for promoting and improving the oral health of children in Rwanda and to address inequality in oral health care. This project mainly based on providing the campaign to the community where we go and teach oral health education, and we provide toothpaste and toothbrush to the children and their parents, mainly in school and in the village. Also, this project, we have the project of designing the material of educating oral health education. Mainly we start about like this card is where we play the this game playing card as game, where the card they provide the some graphic design showing the and guide the children for oral health and give the message. Also, we have project going of designing board game. The objective of this pre-assessment study we did as we conducted this study to determine the sustainability of the Smile for All project and how it will be implemented. Also, we conducted this study to access the current community oral hygiene behavior. Also, during conducting this survey, we was like to ask the community about the view of using the games in oral health education. Methodology, we used this survey we conducted as cross-section descriptive study, where the data was collected by interviewing during World Oral Health Day 2022 campaign. Also, we designed Google form, which is contains some question, and we distribute on social media, where the parents was help us to answer the question on our questionnaire on social media. The analysis we present the data in the form of histogram and pie chart in the number and percentage, and we have analyzed the data by SPSS 25 version. The result, we had the 1,000 participants where 645 were males and 355 were female. During also the findings has shown that the 7% of the participants reported that they are brushing twice a day, while the 18% were while the 18% brush once a day, 10% brush sometimes, and 2% of participants they didn't brush or they don't practice oral hygiene in their life. On discussion, this indicates that there is room for improvement in Rwanda children's oral hygiene, and that game have potential to be acceptable and motivated tools to drive it home message and in fun and repetitive and sustainable to the project. Also, the further baseline data on the children about oral health will be acquired in order to compare with knowing through the gaming message at year times interval. This study was the pre-assessment to know the impact of the game. We'll continue to monitor, to do more monitoring and evaluation every month and yearly as the process continues while the project will go on. By conclusion, the data from this project assessment will guide us in implementing this Smile for All project in a sustainable way. Also, will help to manipulate the this project in terms of to meet with the what community needs in order to have the good oral hygiene behavior. Thank you very much.
Thank you so much for your presentation. Any questions? Any questions? No? There we go. All right. So we're going to move on. Thank you, Habimisha. You can stop sharing your screen now. Thank you so much. Okay, so Kenson is ready for his presentation. And Milena, do you want to share Kenson's presentation, please?
Yes, one moment.
Thank you so much. Kenson, can you hear us? Do you want to put on your sound?
Thank you so much. I hear you.
Great. Thank you so much. Nice to see you.
Nice to see you too.
So,
hello, everyone. Thank you, Milena, and thank you, everyone, for your patience. My poster is a baseline study for sustainable oral health in elementary schools in Jacmel. The present study has been conducted in January of the current year in an elementary school in Jacmel named Centre Alcibiade Pomerac, and it is the very first one relating to oral health ever conducted in the community of Jacmel. 3 objectives. First of all, to establish a baseline in order to assess and monitor progress of a pilot toothbrushing education and atraumatic restorative treatment of caries program for children aged 5 to 7 at the Centre Alcibiade Pomerac. Second of all, to lay the foundation for sustainable oral health in Jacmel. And finally, to raise awareness among local oral health professionals on the challenges to be faced. The data were collected using questionnaires, a knowledge, attitude, and practice survey, interviews with the principal and teachers, and a focus group with parents. The knowledge, attitude, and practice survey is the main item of the study as it concerns the direct beneficiaries of the future project. The study population consisted of a total of 30 children aged 5 to 7, whereby 3 groups of 10 were randomly chosen from kindergarten, 1st and 2nd grades. The CAP survey itself is composed of 3 points. Firstly, a CAP interview assessed children's knowledge about oral hygiene. Secondly, an intra-oral examination was conducted for caries detection. And finally, a toothbrushing ability was evaluated. We found 71.43% children had at least 1 decayed teeth. Among them, 50% had at least 2 decayed teeth, 40% had at least 3 decayed teeth, and 35% had at least 4 decayed teeth. We even found children presenting 8 decayed teeth. As you see in the table, the figure number 11, and the result of the toothbrushing ability evaluation, no children were able to brush properly. They tended to brush only the buccal and the occlusal surfaces, but they neglected the lingual surfaces, and we have only 24.14% brushed their tongue. Thank you so much. I'm ready for the questions.
Thank you so much. Thank you so much, Isidore, and for Milena for helping with the presentation.
Thank you so much, Milena, for your help.
You're welcome.
Thank you so much, and for moving around. So the brushing of the tongue. Did you teach the children afterwards how to brush their tongue?
Now, in the present study, I have just evaluated the ability of the children to brush their teeth. I didn't learn them to brush, but I assessed the ability to brush.
Okay, that's great. So it looks like there's some follow-up studies that can be done on this population, on the group to teach some more on the toothbrushing. It was a very interesting study. Thank you very much. And you said you were surprised that some children had 8 cavities, that there were 8 teeth that had tooth decay?
Yes, exactly. There is one children. If you have a look in the poster, you will have in the 3 tables one of the child in the first grade had even 8 teeth, decayed teeth. That is very, very serious.
And did you ask that child about their sugar consumption or their diet?
Okay, in the questionnaire, I learned that those children do not brush their teeth when they will go to bed, and then their parents do not take care of their teeth properly because parents do not know, and in the focus group with parents, they do not know how to properly brush the children's teeth. And we know other factors, as you said, the sugar consumption and other alimentary issues.
So yeah, there's a great opportunity here for parental education.
Exactly.
Well, afterwards,
exactly.
there's a good follow-up.
Yes, exactly. Because without parents, the toothbrushing will not work, because children will, at home, parents have to know how to properly brush their teeth and to properly help children how to brush their teeth.
That's right. So we can teach the parents. That's a good opportunity to teach the parents as well as the children. Yeah, thank you so much. That's really good. Thank you. For Deborah has a question.
It's just a comment. I just wanted to let you know that these problems are not only in your neighborhood.
Absolutely.
When I went to the dentist for the first time when I was 8 years old, I had 13 cavities.
Wow. Wow.
But
wow.
I made it, I turned it around.
Turned it around and became an oral health educator all your life. So that's taking the challenge and making it opportunity. Thanks so much for sharing. Anybody else? I think we've covered everybody. Is there anyone